a 46-year-old male patient is died because of some respiratory illness. This patient is having some kind of a respiratory illness which is highly infectious. The illness is going to be highly infectious. Okay, beta. Now this patient is now this person is brought for the postmortem. This person is brought for the postmortem. Which of the following method we are going to use in this particular case? तो postmortem के लिए कौन सा method यहाँ पर use में लेंगे? First technique beta we are having is known as Ghon's technique. Ghon's technique is going to be your en bloc technique. It is going to be en bloc technique, where we are going to do what? We are going to take organ blocks, right? यहाँ पर क्या करेंगे? जैसे thoracic ले लिया या abdominal region ले लिया, we are going to divide the complete body into 3 parts. We are going to divide it into 3 parts. So एक thoracic segment ले लिया, एक abdominal segment ले लिया, एक pelvic segment ले लिया, right? So this is how we are going to divide in the blocking system. Organ block will be there, and here we are going to do the organ system dissection, right? Dissection will be there. So that is going to be your Ghon's technique. Virtue, you can remember V for virtue, V for 1 by 1. So here we are going to take out each and every organ 1 by 1. That is going to be the virtue technique. This Letule is going to be the en masse method. En masse मतलब पूरा एक साथ में ही निकाल लिया. That is going to be all together. This is going to be all together. Okay, remember when we are removing via Letule method, the anatomical relation is going to be preserved. So here anatomical relations are going to be preserved. Relations are going to be preserved. Whereas when we are going to do the 1 by 1 method, virtue में क्या होगा? Anatomical relation not preserved. Anatomical relations are not preserved. याद रखना है ये. Not preserved, right? And most important that we are also doing in the COVID-19. अगर कोई भी infectious disease है, so the method that we are using is known as Rokitansky method, and this is a in situ dissection method. In situ dissection method. ये कब करना है? When we are going to do this, whenever we are having any highly infectious disease, right? So for highly infectious diseases, like we were doing this particular thing in the COVID-19, maybe the patient is of HIV or hepatitis B patient, right? So अगर कोई ऐसा patient है, so we are going to do what? Rokitansky. तो Ghon में क्या करना है? एक particular thoracic segment ले लिया, abdominal segment ले लिया, pelvic segment ले लिया. Letule में it is going to be en masse, that means all organs are going to be together. It is going to preserve the anatomical relations, right? Virtue 1 by 1, every organ is V for virtue, V for 1 by 1, you can remember like that. And Rokitansky is going to be for the highly infectious things, right? So in this particular case, highly infectious is given. So your answer in this case will be what? Your answer in this case is going to be your Rokitansky method. What is the method we are going to use? That is going to be your Rokitansky method.